What are the key differences between fee-for-service FFS and value-based care (VBC) reimbursement models? How do these differences affect clinical documentation practices? Answer: the fee-for-service FFS model reimburses healthcare providers based on the number of services rendered. This model encourages quantity over quality. Clinical documentation under FFS is primarily focused on itemizing each procedure, diagnostic test, and consultation to ensure that each service is reimbursed correctly. This requires comprehensive documentation of individual encounters, diagnoses, and services delivered. In contrast, value-based care (VBC) links reimbursement to the quality of care provided, rather than the volume of services. VBC encourages providers to focus on patient outcomes, preventive care, and overall health management. For clinical documentation, this means that there must be detailed records that demonstrate the quality of care, the patient's progress, and any preventive measures or health outcomes achieved. Providers must document evidence-based practices, outcomes, and care coordination to ensure appropriate reimbursement. The primary difference lies in the focus. FFS rewards service volume, while VBC rewards efficiency and patient outcomes. VBC requires more comprehensive outcome-focused documentation, which can include patient progress, treatment plans, and evidence of adherence to clinical guidelines. A hospital has received a denial for a claim citing insufficient documentation of medical necessity for a procedure. What steps should the clinical documentation specialist take to revise and resubmit the claim? Answer: when a claim is denied due to insufficient documentation of medical necessity, the first step is to analyze the denial notice to understand why the procedure was deemed not medically necessary. The clinical documentation specialist should review the specific payer's guidelines and identify which elements of the documentation are lacking or unclear. Next, the specialist should review the patient's medical records to find any additional information or clarification that can demonstrate medical necessity. This may involve checking physician notes, diagnostic test results, or previous treatment plans that support the necessity of the procedure. If additional documentation or clarification is needed, the specialist should contact the healthcare provider who performed the procedure to request any missing details or updates that would demonstrate the clinical rationale for the procedure. Once the necessary documentation is gathered, the claim should be amended and resubmitted to the payer, ensuring it meets the payer's requirements for medical necessity. Dr. Smith is reviewing a patient's medical record and notices that a colleague has upcoded a procedure to increase reimbursement. What ethical principles should guide Dr. Smith's actions, and what steps should be taken to address this issue? Answer: in this scenario, Dr. Smith must adhere to fundamental ethical principles such as integrity, accountability, and professionalism. The principle of integrity requires that all documentation be truthful and accurate. Accountability calls for taking responsibility to correct any errors or unethical actions, and professionalism necessitates reporting improper practices to maintain the credibility and ethical standing of the healthcare institution. Dr. Smith should first verify the discrepancy by reviewing the medical record and comparing the documentation with the actual services provided. If it is confirmed that the procedure was upcoded, Dr. Smith should document the issue internally, making note of the upcoding for review by the compliance officer or ethics committee. The next step is to report the issue using the hospital's established reporting procedures, such as an anonymous ethics hotline or directly to the compliance officer. Dr. Smith should also collaborate with the healthcare team to ensure that the record is corrected and that any financial claims to insurers are accurate. Why is documenting medical necessity critical in healthcare reimbursement, and what could happen if it is insufficient? Answer: medical necessity is a fundamental criterion for reimbursement in healthcare. It ensures that the services provided are appropriate for the patient's condition and are consistent with clinical guidelines. Healthcare providers must demonstrate that the procedures, tests, and treatments are necessary for the diagnosis or treatment of a patient's condition to qualify for reimbursement. Insufficient documentation of medical necessity can result in claim denials, because insurers, including government payers like CMS, may not find sufficient evidence to justify the procedure or service. This leads to delayed payments, financial losses, and potential audits. If medical necessity is not clearly demonstrated, a healthcare provider risks compliance issues and may face scrutiny from regulators or payers. Moreover, repeated failures to document medical necessity can result in audits, refunds, and even legal consequences under the False Claims Act (FCA) for submitting inaccurate or incomplete claims. Healthcare providers must maintain accurate and clear documentation to avoid these risks and to ensure timely reimbursement. What key elements should be included in the documentation of patient consent for the surgical procedure, and how do these ensure legal compliance? Answer: e-documentation of patient consent for a surgical procedure is essential for ensuring that the healthcare provider meets legal, ethical, and regulatory requirements. The key elements of informed consent include patient identification, full name, medical record number, and other identifiers to ensure the correct patient is documented, description of procedure, clear, understandable language explaining the procedure, including the expected benefits and risks and benefits, a detailed explanation of potential complications, side effects, and the expected outcomes of the surgery, voluntary agreement, a statement ensuring the patient understands the procedure and consents to it without any coercion, signature, the patient or their authorized representative's signature with a date confirming their consent. This documentation is essential because it serves as proof that the patient was informed and agreed to the procedure, which is required for legal compliance. The healthcare provider may face legal action if there is no clear record of patient consent, particularly in the event of a dispute or adverse outcome. Discuss the benefits of ethics training programs for clinical documentation specialists. What topics should these programs cover to be effective? Answer: ethics training programs are essential for clinical documentation specialists (CDS) to ensure they comply with legal, regulatory, and organizational standards. These programs benefit healthcare organizations by promoting accountability and integrity. Training helps CDS staff understand the importance of accurate, honest documentation and the consequences of unethical practices such as upcoding or falsifying records, reducing errors and fraud. Regular ethics training raises awareness about potential pitfalls and how to avoid fraudulent documentation practices, enhancing legal compliance. The training ensures that CDS staff are up to date on compliance laws and regulations, reducing the risk of legal consequences for both individuals and organizations. An effective ethics program should cover recognizing and addressing upcoding, educating CDS on how to avoid misrepresenting the level of services provided, understanding HIPAA, ensuring that CDS understand the importance of patient confidentiality and the rules around data sharing, reporting ethical dilemmas, teaching CDS how to report unethical behavior and protect their legal and ethical rights, preventing misrepresentation, training on how to ensure that documentation reflects the actual care provided without manipulation, relevant guidelines. AHIMA's ethical standards for CDI emphasize the importance of honest documentation and maintaining professional integrity in all coding practices. CMS guidelines enforce penalties for fraudulent billing practices, making ethics training a critical tool for ensuring compliance. What are the potential risks of failing to address claim denials promptly, and how can clinical documentation specialists mitigate these risks? Answer: failing to address claim denials promptly can result in financial losses due to delayed or denied payments, as well as increased administrative costs associated with the resubmission process. Additionally, prolonged denials can lead to patient dissatisfaction if they are informed of issues with their claims, affecting the provider's reputation. Chronic denials may also attract payer audits, leading to more scrutiny of an organization's billing and coding practices. To mitigate these risks, clinical documentation specialists (CDS) should implement a denial management strategy that involves prompt review and analysis, reviewing denial reasons immediately to determine the root cause, e.g., coding errors, lack of medical necessity, accurate documentation, ensuring that all patient records and documentation are complete and aligned with payer requirements, timely resubmission, resubmitting corrected claims within the payer's timeframe to avoid delays in payment, collaboration with healthcare providers, working closely with physicians to ensure that clinical documentation accurately reflects the services provided. How can clinical documentation specialists ensure accurate coding and documentation for high-risk, high-cost procedures? Answer: for high-risk, high-cost procedures, clinical documentation specialists (CDS) must ensure that all coding and documentation are comprehensive, accurate, and aligned with the clinical guidelines and pay requirements. This can be done through thorough documentation review. CDS should carefully review all clinical notes, test results, and procedure reports to ensure that the procedure is accurately described. Collaboration with providers. CDS should work closely with the clinical team to ensure that all aspects of the procedure, including potential complications, are documented. Proper coding. CDS should ensure that the correct ICD-10 codes are used to reflect the procedure and diagnosis accurately. This requires knowledge of the coding conventions for complex procedures. Use of modifiers. If applicable, CDS should use modifiers to indicate specific circumstances surrounding the procedure, such as complications or multiple procedures performed. Accurate documentation for high-cost procedures is essential to avoid claim denials, ensure appropriate reimbursement, and prevent legal or compliance issues. What role does clinical documentation play in ensuring compliance with healthcare quality reporting programs? Answer: clinical documentation plays a crucial role in healthcare quality reporting programs, as accurate documentation is the foundation for reporting quality measures to regulatory bodies like CMS. These measures include patient outcomes, adherence to clinical guidelines, and quality of care. Without accurate documentation, healthcare organizations may fail to report data correctly, affecting their performance metrics and reimbursement rates. Key elements of quality reporting depend on documenting patient care, ensuring that all patient interactions, treatments, and outcomes are accurately recorded for quality measures. Supporting quality indicators. Accurate documentation supports the required quality indicators such as patient safety, preventive care, and patient satisfaction. Reporting timeliness. Clinical documentation ensures that all data required for meaningful use or the value-based purchasing program is provided in a timely manner, avoiding penalties. Relevant guidelines. CMS Quality Payment Program (CUPP) use clinical documentation to calculate reimbursements based on care quality. How can clinical documentation specialists contribute to improving healthcare outcomes by enhancing the accuracy of clinical records and documentation? Answer: clinical documentation specialists (CDS) play a critical role in improving healthcare outcomes by ensuring that patient records are accurate, comprehensive, and reflective of the care provided. Accurate documentation allows healthcare providers to ensure continuity of care. Clear and detailed records ensure that healthcare providers across different settings can quickly access accurate patient information. This reduces the risk of treatment errors, enhances decision-making, and ensures appropriate follow-up care. Promote accurate diagnosis and treatment. By documenting the full scope of a patient's medical history, symptoms, test results, and response to treatments, CDS ensure that healthcare providers have all the necessary information to make informed decisions. Accurate documentation also helps in identifying any gaps in care or treatment plans, ensuring that the patient receives appropriate interventions. Improve clinical decision support, CDS. With detailed and precise documentation, CDS can leverage clinical decision support systems to identify potential risks or complications, enabling healthcare providers to take proactive measures before issues become critical. Support quality metrics and reporting. Accurate clinical records are essential for meeting quality reporting requirements, such as the Quality Payment Program (PP) under CMS. These programs require precise documentation to track clinical outcomes, adherence to guidelines, and patient satisfaction. Accurate reporting directly affects the reimbursement rates and the healthcare facility's performance metrics, which in turn can lead to better funding and resource allocation to improve patient care. Reduce readmissions. Accurate documentation of treatments, discharge instructions, and follow-up care can contribute to reduced hospital readmissions by ensuring patients are properly informed about their aftercare and any medications they need to continue. By improving documentation accuracy, CDS help foster a culture of patient safety and clinical excellence, which ultimately leads to better healthcare outcomes. In surgical practices, what are the critical elements that must be included in an operative report to ensure compliance with clinical and legal standards? Discuss the implications of missing any of these elements. Answer: an operative report must contain essential information to ensure both clinical effectiveness and legal compliance. The critical elements include patient identification information. This includes the patient's full name, medical record number, and date of surgery, which is essential for accurate tracking and identification. Preoperative and post-operative diagnosis. The report must specify the condition before and after the procedure to confirm that the surgery aligns with the diagnosis documented. Detailed description of the procedure. This section should include the type of surgery performed, the technique used, and any specific instruments involved. The level of detail ensures that the surgical approach can be reviewed and audited if necessary. Names of the surgeons and assistants. It is critical to list all involved personnel to ensure accountability, particularly in case of complications or legal issues. Complications and management. Documenting any complications, including how they were managed, protects the clinician in case of malpractice claims. Estimated blood loss (EBL). This is crucial for post-operative care, helping clinicians assess the need for transfusions or further interventions. Specimens removed. Any tissue or organ removed during the surgery must be documented for pathological evaluation and future reference. Implications of missing elements. Missing elements can lead to clinical delays or mismanagement. such as inadequate post-operative care or improper follow-up treatment. From a legal perspective, incomplete documentation can be viewed as negligence or poor care, particularly if a complication arises that was not documented. Non-compliance with regulations, such as those set by CMS or the Joint Commission, could result in penalties or loss of accreditation. What specific privacy considerations must be adhered to when documenting patient encounters in behavioral health settings, particularly in light of HIPAA regulations? Answer: in behavioral health settings, documentation requires stringent privacy considerations due to the sensitive nature of the information being recorded. Under the Health Insurance Portability and Accountability Act, HIPAA, and related laws, key privacy considerations include minimal necessary information. This principle mandates that only the information necessary for treatment, payment, or healthcare operations should be documented. This minimizes the risk of exposing sensitive details unnecessarily. Segregation of sensitive notes. Psychotherapy notes, which include information about the patient's mental state, should be stored separately from general medical records. HIPAA recognizes psychotherapy notes as distinct from regular health records and affords them extra protection. Access controls. Behavioral health records must be safeguarded by limiting access to authorized personnel only. This can include using password-protected systems or ensuring physical security of paper records. Informed consent. Before disclosing any sensitive information, especially related to mental health or substance abuse, explicit consent from the patient must be obtained, unless disclosure is required by law. G. Reporting abuse or a potential risk of harm. Auditing and monitoring. Healthcare organizations must have systems in place to monitor access to behavioral health records to ensure compliance with privacy standards. Legal context. HIPAA Privacy Rule 45 CF RSS.502 ensures the confidentiality of health information, including psychotherapy notes. 42 CFR Part 2 offers additional protections for records related to substance abuse treatment. Failure to adhere to these privacy guidelines can result in legal consequences, including substantial fines, civil penalties, and damage to the healthcare provider's reputation. Dr. Amanda recently completed a surgical procedure but did not document the estimated blood loss (EBL) in the operative report. Weeks later, the patient developed complications attributed to anemia. The patient's family is now suing the hospital, citing poor documentation practices. How could this scenario have been avoided, and what steps should Dr. Amanda take now? Answer: the omission of estimated blood loss (EBL) is a critical documentation error. To avoid such scenarios, the following strategies should have been implemented. Timely and complete documentation. Surgeons must document all relevant details, such as the BL, immediately after the procedure, ensuring that the record is comprehensive and accurate. Real-time documentation tools. Implementing HR systems with real-time data entry can minimize the risk of leaving out crucial information like BL. Regular staff training, ensuring that all staff members are trained on documentation standards, particularly in high-risk settings like surgery, can prevent such omissions. Next steps for Dr. Amanda. Amend the documentation. Under HIPAA regulations 45 CF RSS.526, Dr. Amanda can amend the operative report by adding the missing information with a clear note stating the reason for the amendment. This should be done promptly. Patient communication. Dr. Amanda should collaborate with the hospital's legal and risk management teams to address the family's concerns. Full transparency is necessary to restore trust and clarify the situation. Work with legal counsel. Since the family is suing the hospital, Dr. Amanda must consult with legal professionals to understand how the missing BL might affect the case and what mitigation steps are needed. Legal framework. HIPAA's Amendment Rule 45 CF RSS.526 allows for the correction of errors in medical records. In litigation, documentation is often viewed as evidence under federal rules of evidence, particularly Rule 803-6, which governs the admissibility of business records. Explain the unique challenges in documenting the care of pediatric patients compared to geriatric patients and strategies to overcome these challenges. Answer: pediatric documentation challenges. Parental consent. Pediatric documentation requires obtaining consent from parents or legal guardians for treatment, and this must be clearly recorded. In some cases, consent for specific procedures or treatments, such as vaccinations, needs to be detailed in the record. Growth and development. Pediatric care involves tracking developmental milestones and growth metrics, such as weight, height, and head circumference. These metrics need to be updated regularly and are critical for assessing health status. Immunization records. Accurate and up-to-date immunization records are essential in pediatrics to ensure the child is following the recommended vaccination schedule. Missing or incomplete vaccination records can lead to compliance issues with school or daycare entry requirements, geriatric documentation challenges, polypharmacy risks. Many elderly patients are on multiple medications. The geriatric documentation should include accurate medication lists, including dosages and any changes over time, to avoid harmful drug interactions. Cognitive impairments. In elderly patients with dementia or other cognitive conditions, it is important to document cognitive assessments and any changes in mental status, as well as plans for decision-making and consent. Advanced directives. Documentation of advanced directives, such as living wills and power of attorney, is particularly important for elderly patients. These directives help ensure that a patient's wishes are respected in case of incapacitation. Strategies to overcome challenges. Implement age-specific checklists for both pediatric and geriatric patients to ensure all essential data points are recorded. Use electronic health records (EHRs) with age-appropriate templates to guide documentation. Provide continuous education for healthcare providers on age-specific considerations in documentation. What are the key preventative strategies to mitigate risks associated with delayed documentation, and how can these strategies reduce liability? Answer: delayed documentation presents significant risks, including miscommunication of clinical data, improper follow-up care, and increased potential for legal claims. Key preventative strategies include real-time documentation. Encouraging healthcare providers to document as care is provided ensures that records are accurate and complete. Real-time entry reduces the chance of forgetting key details and prevents errors caused by delayed recollection. Automation and alerts. Using EHR systems that provide alerts for missing or incomplete documentation can help ensure that critical elements are not overlooked. For instance, a reminder for EBL or a check for missing diagnoses can reduce documentation errors. Regular training. Ongoing training for staff on the importance of timely documentation and the potential legal and clinical risks associated with delays helps foster a culture of compliance. Audits and peer reviews. Implementing routine audits and peer reviews of documentation ensures that records are completed in a timely and accurate manner. Auditors can catch any delays and provide feedback to clinicians. Reduction in liability. By ensuring timely and complete documentation, these strategies reduce the risk of errors, misinterpretations, and omissions that could lead to negative patient outcomes or legal claims. Real-time and accurate documentation provides a solid defense in malpractice cases as it shows adherence to standards of care. Legal basis. The Joint Commission and CMS provide standards for documentation, emphasizing timely and accurate record-keeping to reduce risk. What constitutes a valid psychotherapy note under HIPAA, and how does its storage differ from general clinical notes? Answer: psychotherapy notes definition. Under HIPAA, psychotherapy notes are distinct from general medical records. These notes are considered highly sensitive and receive additional protections. They typically include detailed content of sessions. Psychotherapy notes include the therapist's subjective impressions, thoughts, and analysis of the patient's behavior, mood, and progress, which are not intended for inclusion in the medical record. Specific treatments or techniques used. Any specialized interventions or therapy techniques applied during the session are recorded in these notes. Sensitive patient information. These notes may contain information about personal struggles or intimate details discussed in therapy, providing a raw and unfiltered account of the session. Storage and privacy. Psychotherapy notes must be kept separate from general clinical records. This segregation ensures that they are not inadvertently accessed by non-mental health professionals, preserving confidentiality. Healthcare providers must also obtain explicit written consent from the patient before releasing psychotherapy notes, except in specific legal circumstances. What are the legal consequences of failing to follow proper documentation procedures in the healthcare industry? Answer: failing to follow proper documentation procedures in healthcare can result in several legal consequences. Malpractice liability. Inaccurate or incomplete documentation may serve as evidence in malpractice lawsuits. If a healthcare provider fails to document crucial information or makes errors in the record, it may be interpreted as negligence, increasing the likelihood of legal action. Regulatory penalties. Regulatory bodies such as the CMS and Joint Commission have strict documentation standards. Failure to comply can lead to penalties, including loss of accreditation or reimbursement, criminal charges, In extreme cases, especially when falsification of records is involved, healthcare providers may face criminal charges for fraud under statutes such as the False Claims Act. Loss of trust. Incomplete documentation can undermine trust between healthcare providers and patients, leading to dissatisfaction and potential complaints to the state medical board. What security measures should healthcare providers implement to protect digital health records from cyber threats? Answer. To protect digital health records from cyber threats, healthcare providers should implement a combination of technical, organizational, and physical security measures, including encryption. All digital health records should be encrypted, both at rest and in transit, to ensure that even if data is intercepted, it remains unreadable. Access controls. Implement strict access control policies, such as role-based access, ensuring that only authorized personnel have access to sensitive information. Multi-factor authentication (MFA). MFA adds an additional layer of security, requiring users to provide multiple forms of verification before gaining access to records. Regular audits. Conducting regular security audits to identify vulnerabilities and ensuring compliance with HIPAA standards is essential for protecting health records. Employee training. Regular cybersecurity training for all staff ensures that employees understand the importance of maintaining confidentiality and are aware of common cyber threats like phishing. What are the ethical implications of falsifying documentation, and how can healthcare professionals avoid such ethical breaches? Answer. Falsifying documentation is a serious ethical violation with far-reaching consequences, including loss of professional integrity. Falsifying records undermines trust in healthcare professionals and the healthcare system. It compromises the core values of honesty and integrity. Patient harm. Inaccurate records can lead to improper care decisions, risking patient health and safety. Legal consequences. Healthcare professionals found falsifying records can face disciplinary action from licensing boards, loss of medical licensure, or criminal charges. Impact on trust. Falsification can erode trust between healthcare providers and patients, leading to reputational damage and decreased patient satisfaction. Avoidance strategies. Strict adherence to documentation guidelines. Professionals should follow institutional documentation policies to ensure accuracy and completeness, accountability and transparency. Healthcare providers should take responsibility for their actions and refrain from altering records to cover up mistakes. Why is it crucial to ensure the accuracy of patient data in electronic health records, and what can be the consequences of inaccuracies? Answer. Ensuring the accuracy of patient data in electronic health records is essential because improved patient care. Accurate data is essential for providing safe and effective care. Inaccuracies can lead to incorrect diagnoses, improper treatments, and medication errors, potentially harming patients. Legal protection. Accurate documentation serves as evidence in case of legal disputes. Inaccurate records can expose healthcare providers to malpractice claims or regulatory penalties. Operational efficiency. Accurate records streamline administrative processes, ensuring that follow-ups, prescriptions, and referrals are made correctly, reducing delays and errors. Regulatory compliance. Healthcare organizations are required to maintain accurate records to comply with laws and regulations such as HIPAA and CMS standards. Consequences of inaccuracies. Inaccurate data can result in medical errors, delayed treatment, financial penalties, and loss of trust between healthcare providers and patients. Why is engaging patients in the documentation process crucial, and what are the risks of excluding them? How can healthcare professionals facilitate meaningful patient involvement? Answer. Engaging patients in the documentation process is essential for several reasons, including enhancing the accuracy of medical records, improving patient satisfaction, and fostering a sense of ownership over their healthcare journey. When patients actively participate, their perspectives and preferences are more accurately reflected, ensuring that care is aligned with their values and goals. This transparency also builds trust, which can lead to better adherence to treatment plans and better health outcomes. Excluding patients from this process can lead to miscommunication, errors in documentation, and potential harm, as healthcare providers may overlook important personal or lifestyle factors that could affect treatment efficacy. It may also result in patients feeling disempowered or alienated from their care team, which may undermine their willingness to engage in treatment. To facilitate meaningful patient involvement, healthcare providers should use accessible language, ensure that patients understand the purpose and importance of accurate documentation, and encourage them to ask questions or provide additional information. Identify and explain 3 common forms of bias in clinical documentation. How can healthcare providers ensure neutrality in patient records? Answer: clinical documentation can be susceptible to various biases that influence the accuracy and objectivity of patient records. Three common forms of bias include implicit bias. Unconscious attitudes or stereotypes can influence how healthcare providers document patient information. Cultural bias. Stereotyping based on a patient's ethnicity, religion, or background can result in misinterpretation of their behaviors or concerns. Cultural values and norms may influence patients' responses to treatment, and failing to consider this can lead to inaccurate documentation. Confirmation bias. This occurs when a healthcare provider favors information that supports their pre-existing assumptions or beliefs while disregarding contradictory data. To avoid bias, healthcare providers must make a conscious effort to document objectively, focusing on facts and clinical observations rather than assumptions. The use of neutral, descriptive language and active listening can help in avoiding implicit and cultural bias. Training in cultural competence and promoting awareness of biases are crucial steps in ensuring documentation is fair and accurate. Dr. Patel is discussing a treatment plan with Mr. Johnson, a 58-year-old patient with diabetes. Mr. Johnson prefers alternative treatments and expresses concerns about medication side effects. Dr. Patel documents the conversation briefly. The patient is non-compliant with standard diabetes treatment. What are the issues with Dr. Patel's documentation, and how should it be revised to reflect shared decision-making and transparency? Answer: Dr. Patel's documentation is problematic because it uses the term non-compliant, which is judgmental and does not capture the nuances of Mr. Johnson's concerns. The term non-compliant implies that the patient is refusing treatment without providing context about why the patient made that choice. It fails to acknowledge Mr. Johnson's expressed preference for alternative treatments due to his concerns about side effects, which is an important part of the shared decision-making process. The revised documentation should reflect a more collaborative and respectful approach that includes the patient's preferences and outlines the shared decision-making process. A better entry could read: discuss standard diabetes treatment options with Mr. Johnson, including potential side effects. The patient expressed concerns regarding side effects and expressed interest in exploring alternative treatments. The treatment plan will be reassessed at the next visit after further research and consultation. This revision accurately reflects the patient's preferences and demonstrates a willingness to engage in a two-way conversation about treatment options. It ensures transparency and fosters trust between the patient and the healthcare provider. What are three effective methods for improving clinical documentation skills among healthcare professionals, and why are they important? Answer: improving clinical documentation skills is crucial to ensure that patient records are accurate, complete, and legally compliant. Three effective methods for improving documentation skills include workshops and role-playing exercises. These hands-on activities help healthcare professionals practice documenting in real-life scenarios. Role-playing allows clinicians to engage in simulated conversations with patients, making it easier to understand the importance of accurate documentation in various contexts. Mentorship programs. By pairing less experienced clinicians with seasoned professionals, mentorship programs provide opportunities for one-on-one learning and real-time feedback. Real-time feedback mechanisms. Providing immediate feedback to clinicians after a documentation session ensures that mistakes or gaps in documentation are addressed promptly. These methods are essential because they help healthcare professionals stay current with evolving documentation standards, ensure compliance with regulatory guidelines, and reduce errors that could negatively impact patient care or legal outcomes. Why is incorporating social determinants of health (ESTO) into patient records critical, and how can this information influence patient care? Answer: incorporating social determinants of health (ESTO) into patient records is critical because it provides a comprehensive understanding of the factors influencing a patient's health. SDOH, such as socioeconomic status, access to healthcare, education, and living conditions, can significantly impact a patient's ability to adhere to treatment plans and overall health outcomes. By documenting these factors, healthcare providers can develop more personalized and effective treatment strategies that address the root causes of health disparities. For example, a patient living in a food desert may struggle to maintain a healthy diet, which affects their diabetes management. By documenting this information, the healthcare provider can connect the patient to resources like nutrition assistance or local food programs, helping to address the non-clinical barriers to care. Incorporating SDOH also supports a holistic approach to patient care and enhances care coordination among multidisciplinary teams. It empowers healthcare providers to offer more targeted interventions and improve patient outcomes. How can clinicians document a patient's financial challenges without introducing bias or stigma into their medical record? Answer: when documenting a patient's financial challenges, it is essential to use neutral, non-judgmental language that respects the patient's dignity and avoids perpetuating stigma. For example, instead of stating, "A patient refuses to purchase medications due to financial irresponsibility," a more neutral and accurate entry would be, "Patient reports difficulty affording prescribed medications due to financial constraints. Discuss potential alternatives and will reassess at next visit." This language focuses on the facts. Financial constraints, without casting judgment on the patient's choices or behavior. Additionally, it opens the door for further discussion about possible solutions, such as exploring less expensive alternatives, helping the patient apply for financial assistance, or connecting them with community resources. By avoiding biased or stigmatizing language, clinicians ensure that patient records remain respectful, accurate, and focused on providing effective care. What is the role of shared decision-making in improving patient outcomes, and how should it be documented? Answer: shared decision-making, SDM, is a collaborative process in which healthcare providers and patients work together to make informed decisions about treatment options. This approach improves patient outcomes by ensuring that the chosen treatment aligns with the patient's values, preferences, and lifestyle, which can lead to greater satisfaction, adherence to the plan, and better health outcomes. In clinical documentation, SDM should be thoroughly documented to reflect the patient's involvement in the decision-making process. The documentation should include the treatment options discussed with the patient's preferences, including any concerns or questions raised, the agreed-upon plan, including follow-up steps and future reassessment. For example, discuss treatment options for managing hypertension, including lifestyle changes and medication. Patient expressed preference for lifestyle changes first, with follow-up in 3 months to reassess. Proper documentation of SDM ensures that patients' values and decisions are clearly recorded, providing clarity for other healthcare providers involved in the patient's care and demonstrating compliance with patient-centered care principles. What are the risks of not updating clinical records regularly, and how can these risks be mitigated? Answer: failing to update clinical records regularly can lead to several risks, including the provision of outdated or inaccurate information, which may result in improper care decisions. For instance, if a patient's allergy status or medication list is not updated, they could be prescribed a medication that causes an adverse reaction. Additionally, outdated records can hinder communication between healthcare providers, leading to fragmented or conflicting care plans. To mitigate these risks, healthcare providers must implement a routine system for updating patient records. This can include setting reminders for regular updates, encouraging patients to report changes in their condition or medication during visits, using electronic health records systems that prompt for updates. Regular updates help ensure that all care providers have access to the most current information, reducing errors and improving patient outcomes. Explain the importance of cultural competence in clinical documentation and what strategies can healthcare providers employ to enhance it. Answer: cultural competence in clinical documentation is vital because it ensures that healthcare providers respect and understand the diverse backgrounds and needs of patients. When healthcare providers document with cultural competence, they avoid stereotyping and ensure that patient records reflect the uniqueness of each individual's values, beliefs, and preferences. To enhance cultural competence, healthcare providers can engage in cultural competence training to increase awareness of their own biases and learn how to effectively communicate with diverse patient populations. Use culturally appropriate language in documentation, which respects the patient's background and avoids assumptions. Involve interpreters or cultural liaisons when necessary to ensure clear communication, especially in cases where language barriers exist. These strategies ensure that clinical documentation accurately reflects the patient's cultural context, leading to better care outcomes and increased trust between patients and healthcare providers. What is the role of technology in enhancing clinical documentation, and what challenges might healthcare professionals face in using these tools? Answer: technology plays a critical role in enhancing clinical documentation by streamlining the process, reducing errors, and improving efficiency. Electronic health records systems, for example, allow healthcare professionals to document patient information quickly and accurately, facilitate real-time updates, and ensure that all team members have access to the same information. However, challenges include training. Healthcare professionals may require significant training to effectively use new HR systems. Data overload. HR systems can sometimes lead to excessive information being documented, which may make it difficult to extract relevant details quickly. privacy and security concerns. The digital nature of records raises concerns about data security and patient privacy. To overcome these challenges, healthcare institutions should provide ongoing training, implement user-friendly EHR systems, and prioritize data security protocols to protect patient information.